Welcome, everyone. I'm John Dauphiné. I'm the CEO of the Foundation for Financial Planning. We are really excited about this pilot, and we couldn't do it without all of you. So thank you so much for stepping up, and I think you'll find it to be a meaningful experience. And today we're going to go over everything you need to know to get started. First, I will introduce some of my colleagues. We have Yolanda Walsh, and we have Marla Weston, and they are with the American Nurses Foundation. And they'll talk a little bit more about that organization as we move forward. You'll be hearing from them. But we are so pleased to partner with them and so impressed by the work they're doing to offer support to nurses who are, as we all know, on the front lines of this pandemic and often caring for others as they perhaps, aren't able to care as well for themselves. My colleague also, Rachel Roth, she's our Director of Grants and Programs, and she's been very involved in this pilot. And I also really want to thank Christine Cataldo, Rick Edelman, who helped us make the connection. And again, all of you, our understanding is that Edelman has a history of delivering pro bono services to nurses, which makes, Edelman Financial Engines just the most ideal partner we could find for this pro bono work. So again, thank you. Why don't we flip to the first slide here. And I can, okay.
And John, just to interrupt, just to let everyone know, this is going to be recorded so that people who could not attend today can view it.
Yes, thank you, Rachel. So what we're going to do today is I'm going to talk briefly about the partnership and how it came to be. Yolanda will then talk about the picture that nurses are going through right now with the pandemic. And there's a lot of data that I think will be really informative. So I know some of you may have provided pro bono to nurses in the past, but of course now we're in a very challenging environment, as everyone knows. So we'll talk a bit about that. Rachel will address the process that we'll be using to deliver services. And Yolanda is really the point person for the nurses organization. So you'll be working with her, and I really want to thank her for her partnership. We're hoping Christine will say a few words about Edelman's longstanding commitment in this area, which again is so impressive. And then Marla will lead us in some Q&A as we go along. So if we can go to the next slide. I'm not sure if folks are familiar with the Foundation for Financial Planning, but I wanted to give just a very brief kind of a snapshot. We basically, we're an organization based in Washington, D.C. We've been around for 25 years, and we were founded by financial planners who were serving a lot of high net worth clients in their regular practices, but wanted to also lend their talents and skills to help underserved people who normally couldn't access great financial planning and advice. So that's how we got started. And over time, we've grown. We've been able to do more and more. We do 5 main things. One is we make grants to support organizations across the country that have pro bono financial planning and advice programs. 2 is we try to rally volunteers to put up their hands and get involved. And we actually have a new platform called ProBonoPlannerMatch.org, where we encourage CFP professionals to sign up, and then we encourage nonprofit partners to post opportunities, and we try to make that match so that we can grow opportunities to give back across the country. We also do free resources. We have kind of a Pro Bono 101 that if you haven't gone through it, we definitely encourage. You get an hour of CE credit from CFP board, and it's just very, it's a very brief, but I think helpful session. Finally, we do awareness building, and we're really, really interested in getting out the word to the press, the trade press and the popular press about the good work that financial advisors are doing in their communities. And we know sometimes financial advisors take a black eye in the press, and we are, on the opposite side of that coin. We are the ones that extol the awesome work that goes on to help families. And I encourage you to check out our website. We have a whole impact stories section at ffpprobono.org. And it goes through lots of stories of planners and clients and grantees that I think you'll find inspiring. And then the last thing we do really relates to today's session. We do special kind of program models. When we think there's a particularly vulnerable population that we really want to help, we reach out, we foster partnerships, and we work with our partners to develop pilots and develop programs. We have one that we've had for a couple years, Pro Bono for Cancer, that helps families with serious cancer that are financially struggling. And we realized in the pandemic that frontline nurses are a very vulnerable population. And our partners had really, really robust services to help them, but we felt like financial planning could be so additive to that. And so we're so excited to launch this pilot with you. Very briefly, because I know my colleagues will also amplify this, the American Nurses Foundation is related to the American Nurses Association, and Marla Weston used to be CEO of the American Nurses Association, so I can't think of anybody better to be very involved in this work. She has really led the way for nursing in America, many, many aspects of it. And in partnership with them is Nurses House. And that is a charity that can make emergency cash grants to nurses who are struggling financially. And of course, during COVID, they've been a very important resource to nurses. And that's where we'll be getting the nurse clients for you all as part of this program. And then I don't have to tell you about Edelman Financial Engines other than to repeat, again, we know that there's been a commitment to serving nurses pro bono in the past, and we're really excited to have this partnership. So with that in mind, I think, I guess the last thing I will say is it's a pilot. You know, I think we'll learn together. We are hoping to grow this work after we assess the pilot. We'll be doing some instruments to evaluate your experience and the experience of the nurses. The rough dimensions of the program is to have about 10, 15 certified financial planner volunteers who will be helping a minimum of about 20 nurses. And we're asking for a commitment of about roughly 6 hours per client at roughly 3 meetings per client. And generally the flow is, you know, a getting to know you meeting, exchanging data, and then a meeting that's more presenting recommendations, and then a follow-up meeting to check in. And in discussions with Christine, she has said that that sort of rhythm was actually quite similar to what Edelman had been doing in its pro bono work for nurses in the past. So it mapped really pretty well. So with that as kind of the overall structure, you know, I'm happy to take any questions now or turn it over to my colleagues to dive in a little bit more. Any questions? Okay, great. Well, why don't I turn, Yolanda, I think,
Yes.
I think you're next on deck. If we can turn to you.
Awesome.
Thank you.
Okay. So again, thank you, John. As was previously mentioned, my name is Yolanda Walsh, and I am a very proud member of the American Nurses Association Foundation programming team. Again, on behalf of my colleague Marla Weston, who's also on the call today, we'd just like to thank each of you all for your willingness to participate in our endeavors today. And we'd like to thank each of our partners who have worked effortlessly to bring this to fruition, and we are just excited to get this programming underway. This afternoon, I have been charged with the responsibility of sharing with you all some background information on the American Nurses Association, as well as the programming we have been doing to support the well-being of our country's nurses during this difficult COVID environment, as well as sharing with you all some information on the demographics of nurses and the nursing profession. We thought it would be helpful for you all to understand a little bit more about what your clients' lives look like and what some of the challenges are they're facing. As John mentioned, we will be taking questions after the presentation, but if you should have questions as we go along the way, please feel free to type those in the chat, and my colleague Marla will monitor those and make sure we get all of those answered at the end, okay? So the American Nursing Associations Foundation, in collaboration with, as part of the American Nurses Association, launched the Coronavirus Response Fund earlier this year in response to all of the heightened demand that our nurses are currently undergoing. The American Nurses Association and the foundation has a longstanding commitment to promoting the well-being of nurses and to getting us towards a healthier world through the power of nursing. Our goal is to empower nurses and put them in a better position to then help those that they serve be healthier. Through the Coronavirus Response Fund, which was first created to respond to the heightened demand of the coronavirus pandemic, we then launched the Wellbeing Initiative. The Wellbeing Initiative was created to house specific programming that focused on meeting some of the specific challenges that we were seeing nurses struggle with as a result of their increased demand. These varied from the need for PPE to the need for additional resources and information about fighting the pandemic, as well as different tools to help with the different residual effects they were feeling as a result of their increased demand. And here on our Wellbeing Initiative slide, you can see some of the partners here that we work with to bring about some of our programming. I invite you, if you have not already, to see the American Nurses Association's website and the foundation website to get more specifics about some of the programming we have been engaged in. Whereas this might be surprising for many of you on the call today, it is well known within the healthcare community that whereas nurses are passionate and extremely dedicated to the care of others, they often fail to provide the same level of care and commitment to their own physical, mental, and emotional well-being. Numerous statistics have shown that while nurses excel at caring for others, they often neglect themselves. And unfortunately, as we are presently witnessing firsthand, providing care for others during times of crisis and increased demand further exacerbate nurses' propensity to neglect self-care. Before the COVID-19 pandemic, you will see her on the slide on the left, nurses reported experiencing burnout. 35 to 50% of nurses reported experiencing burnout. 15 to 22% of nurses experienced post-traumatic stress, and 43% of the respondents from our particular survey expressed that they felt that they were underappreciated and not acknowledged in their profession. Once the pandemic set, and presently, nurses are now reporting an increase in being affected physically, emotionally, financially, and this slide, professionally, I'm sorry. For the purposes of today's call, I would like to highlight a few very specific statistics and data points that will be helpful to each of you as you consider the different ways in which your services can best contribute to the financial well-being of nurses. 43 to 41% of today's nurses reported delaying purchases as a result of financial hardships post-pandemic. 43 to 37% reported having to use savings in order to get by. This is all since the pandemic began. 37 to 29% reported having to use credit cards for daily expenses, whereas that was not their situation. 32 to 23% reported reduced utilities or services. 26 to 20% reported that they had searched for new places of employment, new jobs. 14.7 to 10.5% reported that they had to reach into their retirement savings in order to meet regular expenses. 12 to 8.1% reported that they had taken on additional temporary work to support their financial responsibilities. 16.8 to 7.1% reported having had to borrow from family and friends. 4.8 to 3.9% reported having taken on a personal or home equity loan. 3.5 to 2.6% reported receiving assistance from an employer, while 9.2 to 2.4% reported receiving assistance from a charity, including a food bank. 12.6 to 23.9% reported no change in their financial situation. And lastly, 14.2% of nurses reported having been furloughed or lost their jobs, while 27.2% have had their work hours reduced. I would like to explain on these statistics that the margin or the two numbers given represent two different demographics. The higher percentage represents the rate at which nurses of color have been affected, and the lower number represents the percentage at which white nurses have been affected. In addition to those specific statistics, I would also like to bring to your attention the following nurse demographics. As I mentioned, nurses are known for having poor self-care. In addition to that, their greatest asset is their time. So as the American Nurses Foundation has worked throughout the pandemic to create programming to support nurses' well-being, we have noticed that we have got the most engagement and had the most success in nurse participation when the programs offered were not burdening as far as their time commitment or overly burdening as far as what the particular program required them to engage in. So I'd just like to keep that in mind, whereas some of your normal clients might be willing to invest extensive amount of hours in the financial planning process, nurses' time constraints are a little bit more impeded. In addition to that, nurses work various hours. The scope, demand, and location of their employment varies. They work different shifts. They work in different environments, some in hospitals, some in government institutions, some in nursing facilities. And so because of that, their availability to communicate with you might be different than the normal 9 to 5. Nurses have also expressed to us that they have a pretty significant concern in, about privacy when it comes to obstacles to getting them engaging in getting assistance that increase their well-being. And by that, I mean, for some of the programs we have offered, nurses have reported that they sometimes are hesitant to participate because they don't want others to know that they actually need help. They actually feel that expressing or the word getting out that they need help would make it seem like that they aren't adequately fulfilling their responsibility or that they're not on task. Nurses often have significant familial responsibilities, which in large part has to do with the fact that 88% of nurses are female, and the average age range of nurses is 43. There are 4 million nurses in the United States, but only 3 million in the workforce. So that means there are 1 million nurses out there who are no longer employed as RNs or who have moved on to other careers. As mentioned, 88% of nurses are female, leaving 9% male. 19.2% are minorities. 41.7% hold a BSN, which is important to keep in mind when we think about issues of student loans and debt. The median pre-tax earnings of nurses is $65,754. For men, it is $76,273, but for women, it is $64,351. So we still see that disparity amongst gender. And lastly, 59% of RNs work in hospitals. For those who work in hospitals, there still is a significant amount of variance as to where in the hospital they work and to what their roles are. Nurses can be found in the emergency nurses, intensive care, medical administration, perioperative surgical nurses, pediatrics, and within the field of education. And so there is great diversity even within the profession, which further speaks to how their needs will be different financially. As for the remaining 41% of nurses that don't work in hospitals, they are employed in the following areas. And you can see here from the graph that 2% of nurses are employed state, local, and private hospitals. 16% are employed by the government, and 23% are employed in nursing and residential care facilities. So all of that information, with that, it is our hope that the information that I provided on the demographics and background of nurses in America will provide each of you with the context needed to best serve your new clients. Rachel Roth from the Foundation for Financial Planning will now provide some helpful information for your roles and the specifics on our program. Rachel?
Yolanda, can you switch the slide? Thanks. Great. So as is the case in regular regular financial planning engagements, the needs of your clients might differ. For pro bono engagements, some clients might have broad questions and might require a big picture financial plan to help them improve their financial lives and set and prioritize goals. Others might have specific questions. So it really depends on the specific needs of the client that you're working with. We found in pro bono engagements that often clients need help with assessing and developing a household budget, organizing their finances, managing and prioritizing debt, helping them to save for an emergency fund, or beginning to invest, understanding complex concepts. Some clients might have questions related to insurance, mortgages, taxes. Others might have questions navigating employee and government benefits like Social Security and Medicare. So your role really depends on the needs of your client. Next slide. Great, and I'm just gonna take a few minutes to walk you through the process in this pilot program. As you already know, it's obvious, Nurses House and the American Nurses Foundation recruits nurses who will be the clients, and Edelman, you are the volunteers. So Yolanda will send you a volunteer agreement, and these are ground rules for providing financial planning through the American Nurses Foundation and Nurses House. It acknowledges things like you're a CFP professional, you won't sell or advertise your firm's products or services to the pro bono client, you've received approval from your firm, and that you'll make contact with your client, usually within 2 business days. So after that's taken care of, Yolanda will match you with your client, a nurse, through an email introduction. Both the client and the financial planner must sign the letter of engagement. So a pro bono letter of engagement states information like the planner is not responsible for implementing the financial plan, monitoring or updating the plan. The engagement ends when you deliver the plan to the client, or when the planner and the client provide written notice that the engagement has been finished. You will not sell any products or services to the client, and the engagement letter reiterates that you volunteered to provide a free service and will not enter into a paid relationship. So after matched and after the engagement letter is signed, you should reach out within 2 days to schedule a time to meet with your client. And if the client isn't responsive, after about 3 reach outs, you can let Yolanda know, and she'll help connect with the client and follow up with you. At the end of the engagement, you and the client should fill out an end of engagement client report or survey so we can track information about each of the engagements, how the engagements went, and what you helped your client with. Finally, in this pilot, we asked that you meet with about 2 nurse clients, either simultaneously or consecutively, and you can work with Yolanda on your preference. Typically, we ask that you meet with the client up to 3 times, but the needs always depend on the specific situation of the client that you're working with. Okay, next slide. So these are some tips that we have found from some of our other pro bono financial planning programs. We've been working with an organization called Family Reach to develop a program to help cancer patients and their families. And here are some tips that we've learned from that program. And I think a lot of them apply here. So you're going to want to set expectations. You're going to want to discuss with your client that it's a short-term engagement, walk through the letter of engagement with them. You're going to want to walk them through the process. So, most of these clients, they might not know what financial planning is. You want to take small action steps and help ensure that it's not too overwhelming for them. Focus on their specific goals and be patient. I think that's something that we found is important in all pro bono financial planning engagements. Often the client's schedules are unpredictable. They might have higher priorities in financial planning, so be patient and empathetic. Next slide. And know that you're making an impact. Sometimes we have received feedback from financial planners that they don't feel like they're helping. The work that you do with pro bono clients is often different than the work you do with more affluent clients. Simply by being there for your client, acting as an objective, ethical listener, you are helping them. Be open to hearing their story. And you may not be able to fix everything. There may be things that are really out of your control or out of your client's control, but there really is power in reassuring individuals that they're doing the best that they can. Celebrate small victories. Make sure that you focus on the positive. And feel free to ask for support. Nurses House, the American Nurses Foundation, the Foundation for Financial Planning, we're all here if you need extra support. If you have trouble reaching out or reaching your client, just let us know if you haven't heard back from them or if you need extra resources. So next slide. So here are some of the resources that the Foundation for Financial Planning offers. We really encourage you to take the Pro Bono Financial Planning Volunteer Training. It's a free 50-minute online module, helps you understand the basics of pro bono financial planning if you haven't done it before. By taking the training, you're eligible for 1 hour of CE credit by the CFP board. And after this session, I'll send you a link to the training. We also have a Coronavirus and Pro Bono Financial Planning Resource Center. There we have information on government resources, provisions in emergency legislation that can help individuals, some recordings of some webinars that we did. So I will also send you the link to that. And finally, you probably have resources that you can use to help, track budgets, cash flow, bill payments, etc. But we also provide a number of resources to financial planners and to pro bono clients that may help with your engagements. And I'll also make sure to share those with you. Next slide.
So I wanted to thank John, thank Rachel, thank Yolanda and Marla for putting this training together. Also want to thank my colleagues at Edelman Financial Engines for volunteering and helping out. As you know, we've served nurses as part of our company mission and philanthropy for a number of years. Rick and Jean have donated $1 million plus to the Inova Nurses Foundation in Fairfax, and we continue to offer free retirement reviews and free financial plans for nurses. So a lot of you probably already have experience working with nurses. I don't know if there's anything you would be willing to share here with this group, but I think separately I'll set up a Teams page for us, for everybody on this group, so that we can share any questions you may have, or any best practices. We can continue the conversation while this engagement is going on, so that you have another resource as well. So I'll turn it over to all of our Edelman colleagues if you've got any questions or any best practices that you would want to share in working with nurses in the past.
Question. I know you mentioned that this is pro bono and we signed a letter of engagement, but what happens if we go through all the sessions with the nurse and if they do have investable assets that they want us to match?
I'm having trouble hearing.
I think, John, your question was that we go through the pro bono engagement, but what if at the end the nurse says, well, I want some more help and I want to become a client?
Correct. That's my question.
Does that sum it up?
Yeah.
So I'll let John and Rachel speak. I think we want to keep the two separate, and kind of go through the engagement process, make sure that we're communicating with Yolanda how everything has been going, and then close out that pro bono engagement before, we would do anything else. As you're working with the nurses, you still need to provide the privacy policy, the ADV, the normal things that we would do working with any prospect. But I think it's really important that we're focusing on their needs here and their particular engagement, and let them guide where we go later on. But I'll turn it over to our other colleagues here for your advice in previous engagements.
And if I can just say, Christine, that's great, and I totally agree. One of the things in pro bono services, you always want to avoid even the perception of lead generation or paid client cultivation. So what we normally tell pro bono advisors is, if the client, and for example, this came up after 9/11, when a lot of folks who didn't have a lot of resources, who were victims' families or first responders and families, they came into significant resources afterwards. And what we said there was, sorry, my screen was acting up. What we said there was we recommended that the publicly available resources like Planner Search and the like be provided to the pro bono client, that the pro bono engagement be ended. And then if the, if the pro bono client is insistent, like, no, I'm not interested in searching, well, then that's fine. But, but it's just to create kind of a firewall so that it's very clear that this is not for like any sort of lead generation.
I don't really have a question, more so than a comment. I'm very excited to be part of this. This is exactly where I want to be spending my time right now, given everything that's going on in this world. So, thank you for giving me the opportunity to serve. And with that, thank you.
Thank you so much.
Yeah, we appreciate that very much. And again, appreciate all of you stepping up and Edelman stepping up as a firm, because I think, you know, we've all seen the strains, the economic strains the pandemic is creating for so many, and especially for our healthcare first responders and our nurses. So we're really going to, you know, I think learn as we go, and really, really value your feedback, frankly, and your insights. And again, we're hoping to grow the work, but we couldn't do it without you. So thank you very much for that comment.
I have a question, and actually two. So I think this will be to Yolanda, who's going to be matching us. Will it be geographically?
No, so we were not provided the geographic demographics for the nurses that signed up. The American Nurses Foundation is a national foundation, or the American Nurses Association is a national program, and so the nurses come from all across the country, and once you do your initial client intake, you will find more information about where they are. I suppose that is a good point. We could try and see if we can find information about time zones, because I think that would probably help when it comes to putting calls together, but that's a very good point. I will see if they have some privacy constraints that, you know, they wanted to prevent me from finding out too much information about the clients that they forwarded our way, but I will raise that to see if we can't be sensitive around that planning.
Great. And I guess my next question would be, Christine, are we following our normal process in terms of first appointment, second appointment, third appointment, and then kind of taking the lead from the nurse as to how much information they want to give?
Right, so first appointment, you could be doing the data gathering, talking about the process, walking through the agreements. Second appointment would be recommendations after that first appointment. And like we said before, they may or may not need a financial plan, so you'll have to just do everything based on need and take their guidance. And then the last meeting is a follow-up as to, here are the recommendations. You'll probably want to set some time between the second meeting and the third meeting to see if they could actually do some of the recommendations, implement them, or if they need additional help. And that would be the follow-up and then the end of the engagement.
I have a question. So my understanding is that we're supposed to really not talk much about the company. Some of the tools that we have that we use with folks are branded. And so the question is it okay to use those to illustrate different topics?
Yes. Yes, definitely. Yeah, and I think one of the great things is you do have, you know, some additional resources, and you know, if they're not used in a sales context or that type of thing, and I know that's not what you're getting at, then yes, that's absolutely fine.
Great.
Any other questions?
Ooh, I have one.
I
Oh, go ahead, Chris.
got
Oh, you-
so if someone is looking for specific investment advice, you know, like, hey, I've got this account, what should I do with it? Kind of, which direction do we go there? How are we supposed to handle that?
So
Just allocation? Are we just talking allocation? That's as far as we can go?
yeah, and Christine, I don't know if you want to weigh in here, but just kind of from a general pro bono perspective, normally the pro bono client doesn't have a ton of investable assets, but it's more, yeah, like general asset allocation versus you know, recommending specific products, that type of thing. But Christine, you know, I want to make sure I'm being consistent with your past practices with nurses, because I think you probably have experienced this quite a bit.
Yeah, I would agree. I would focus on education and asset allocation and diversification. And you know, your recommendations may be that they need a more diversified portfolio. And then, it's up to them how they want to go about implementing that after, after the engagement.
And I'll just maybe add a little context. Yolanda mentioned this, but just to pull it together, the nurses who have asked to participate in this engagement were pulled from the more than 2,000 nurses that we gave financial assistance to with a direct grant from the American Nurses Foundation through Nurses House during the pandemic. So these were people who got to a point where they needed money. And so I think this is going to be more about supporting them getting their house in order. Because when you do think about the fact that these are people who are making more than $60,000 a year in almost every case, and they rapidly got to a point where they needed financial assistance, they don't have the depth of reserves that they, quote, should have available. And, I think through this pandemic, we have nurses who've recognized that that's one of the places that they need to course correct in their life. Part of why Yolanda shared some of the statistics as well about the number of nurses that were furloughed and have had their hours reduced. I think we're all seeing so much in the news about the degree that nurses are working, but particularly nurses that work not in emergency rooms or not in intensive care units have significantly had their hours reduced. People working in ambulatory care or pediatric care, all the places that you're hearing that care is not being delivered have had a dramatic and significant reduction in their income. And many of these are the primary income earners for their family. So their families have been hit hard.
Marla, that's a great point. And I think the theme, from a planning perspective is, and this is, it varies across pro bono client groups that we, in the programs that we at the Foundation fund, but what may be seen here is very few assets, but an income stream. So that's, that's kind of, I would imagine a fairly common situation. And we do have pro bono clients who have almost no income, in addition to almost no assets. And those are even tougher to advise, as you might imagine. But often they too can even benefit from good advice.
And I think hence a little bit the embarrassment, right? Because frankly, we have 2,000 nurses who should have been standing up saying, I would love to take advantage of this opportunity. So, I think that's part of the opportunity that we have here is to help nurses understand that it is okay for them to ask for help. They give so much help, it's okay for them to ask for expert help.
Excellent point.
I just have one more question around the logistics. Are we going to, when's the timing on this? When does it kind of start?
Now that we've had this webinar training, we will be reaching out to you all by Monday with the contact information, the email address for your particular nurse client, and we would ask that you all reach out to them if possible within that week to make your initial contact. As the Thanksgiving holiday is fast approaching, we really wanted to prioritize trying to make initial contact between nurse and advisor before the holiday so that things kind of don't slip between the cracks, because we, for all of us, the end of the year gets more busier and COVID is picking up all across the country, and so demand is increasing again for them. So you will have an email from me by Monday with that contact information, and we're asking if that's sometime within next week. You make your initial contact. If you aren't able to get in touch with anyone by Wednesday, for example, please reach out to me and I can help facilitate that.
Excellent. Any other questions, comments?
I got one more. The pro bono financial planning volunteer training that you mentioned, will that be sent out via email?
Yeah, I'll send you the link for that.
And then also those additional resources that
Yep.
that we saw too.
Yep.
Great. Thank you very much.
Thank you.
And if during the course of the engagement you have additional, resource needs or questions, don't hesitate. I know you'll have a Teams, sort of portal to talk to each other. But if you want to, give us some recommendations or insights, please don't hesitate. All right. Well, any other questions for today? All right. Well, hey, thank you all for your involvement. I really want to thank our partners, Yolanda, Marla, thank Rachel, Christine, all of you. I think it's going to be a great project. Please don't get frustrated if it's a little hard to make the initial connection. We have found that can be an issue. So let Yolanda know if that's becomes problematic, and she'll really help. But this is, I think, going to be a really meaningful project and a really good pilot, and we really appreciate it. So thanks again. Hope everyone stays safe and well, and have a happy Thanksgiving to everybody as well.
Thank you all for putting this together. Appreciate it.
Thank you so much for your.
Thank you.
Thanks, everyone.